ala tool. First you will look only. Then you will touch the patient, called as palpation. And last you will try to listen something called as auscultation by using this instrument called as stethoscope. Okay? So same in the respiratory system. As a doctor, if you are sitting in a clinic, some patient comes to you with some complaint. You don't know his complaint. So when you will listen the complaint, then you have to decide which system you will examine. Masalan, there are some complaints of the cardiovascular system, you will examine cardiovascular system. If there are some complaints of the respiratory system, you will examine the respiratory system. If there are some complaints of the abdomen, you will examine the abdomen. Sometimes there are combination, two, yani cardio and respiratory both. Then you have to examine the cardio and the respiratory, and you have to decide which is more important. Is it the cardio more important, the problem, yani, or the respiratory? So the problem which is more, you will start from that. Masalan, if there is a patient who comes with a complaint of breathlessness, you know breathlessness? Yani unable to respire, like robot. Okay? Asthma. So this is one of the complaints. Cough, fever, pain in the chest. All of these complaints, they tell us that this person has a problem related to respiratory system. So we will examine the respiratory system. And if you think that he has double problem, you will decide which is more important, respiratory or the cardiovascular. So if the respiratory is more important, you will examine the respiratory first, and then you will examine the cardiovascular, whatever system. Do you understand what I'm saying?
Yes.
Okay? Just like the examination of any other system, we will start from the inspection. Suppose this is my patient. Suppose this is my patient. This patient has masalan, he has breathlessness. Okay? He has dyspnea. You know dyspnea? Okay, he has dyspnea. So I have to examine this patient. If I want to examine this patient, I will start from inspection. Inspection, yani I will not touch the patient. How to do inspection? First of all, you will come at the foot end of the patient. And you will sit and you will try to see the chest. Is it okay? Is there any swelling? Is it moving alright? The color is okay, everything you can see only, without touching. Then, as I have told you before, always examine the patient from the right side. So first I will see from here, then I will come on the right side of the patient. Never stand on the left side of the patient. So this is my right side. Now I will again inspect him. Inspection. Okay? What I will do again, I will come at the level of the subject and I will try to see something. What thing? Masalan, the shape of the chest. Shape. Normal shape of the chest is this in males. This is the normal shape of the chest. But in some cases, this chest can be muhaddib, convex.
Swelling.
We will not call it swelling. It is a deformity of the bone. Sternum.
Like this.
Sternum is like a pigeon. You know pigeon? Hammam.
Yes.
Hammam?
Yes, sir.
What do you call pigeon in Arabic?
Hammam.
Hammam.
Bear?
Hammam.
You mean bear?
Yeah, bird. Pigeon. Hammam. Okay? So, if you have seen hammam, you can figure out that the chest of pigeon is like this. Okay? So in some patient the chest is not like this, it is protruded outwards like convex muhaddab. What is the cause? The cause is the deficiency of vitamin D3. You know vitamin D3? Vitamin D, you know?
Yes, vitamin D.
Yeah, but vitamin D is not active, na? You have to make it active. The active form is called as vitamin D3. D3, salata. Okay? And the complete name of this is 125 dihydroxycholecalciferol. This is the name of vitamin D3. And for the activation of vitamin D3, and vitamin D to vitamin D3, we need two places, the skin and kidney. That is why if there are no sunlight, shams, on the skin, vitamin D cannot be produced. But this is half. Half is done in the kidney. Understand? So when skin and kidney they work good, the vitamin D will be activated into vitamin D3.
In the liver?
This vitamin
In the
kidney.
liver, in the kidney.
And when it is activated, then vitamin D and calcium, they are friends. Friends. Okay? Then vitamin D will help calcium for absorption from the GIT and for deposition in the bones and teeth. Okay? So this is the function of the vitamin D. That it helps the absorption of the calcium, and also it deposits calcium in the azam. So if there is deficiency of vitamin D3, all the bones, they will become soft, not strong. And this condition, yani the deficiency of vitamin D in young children, before adult, before blue, if this deficiency, vitamin D deficiency, before maturity, we call this condition, you know the name?
Yes.
Rickets.
Ricket.
And if the same occurs after maturity,
It's
we
called
call it what? It's called as osteomalacia.
stimulation. Yes.
So osteomalacia is the deficiency of vitamin D. If it is before before maturity, we call it
Rickets.
rickets. If it is after, we call it
Stimulation.
Ali. Qui bosse?
Okay. So listen now. This shape of the chest is normal, but it can be pigeon shape or depressed. It can be convex or concave, both due to the deficiency of the vitamin D. But most of the time, vitamin D called as pigeon chest. So this pigeon chest is the cause is vitamin D deficiency, yani rickets in children. Okay? Now, other thing you will check here. Other things you will check here in the chest. Is there any fracture? Without touching, is there any fracture? Okay? Is there any bleeding or bruise? Okay? Now without touching the patient, you are just seeing it. The color of the chest. Okay, the shape of the chest. And in the last, we will see the eye for anemia. What you will do? You will put one finger just below the eye of the patient and just press down like this. Okay? Then you will see the inside of the eye, which is pink color, red color. True? This is called as, the red color part is called as conjunctiva. Conjunctiva. Okay? Conjunctiva. Normal color of conjunctiva is pink, red. If the person has anemia, severe anemia, this pink or red color
Yellow.
will be converted into not yellow, white.
White.
If it is yellow, it is jaundice, suffer. White. Understand? So, you will see the anemia here. Now, these are some of the things. In the report page, if I can see the report page, the form of the chest is normal. Movement of the chest. Movement. Yes. Movement of the chest, yani chest, whenever somebody is respiring, the chest is moving. Okay? So, normal is what you will write here, because mashallah ta'ala you are normal, you will examine. The chest is movement. Normal movement is normal bilaterally. You will write. Normal bilaterally. I will write you the spelling. Bilaterally, B-I. First you write normal, then bilaterally. Bi means two. And the two sides are moving same. If only one side is moving, you will write unilaterally. Okay? B-I-L-A-T-E-R-A-L-L-Y.
Again, please, by
B-I-L-A-T-E-R-A-L-L-Y. Bilaterally. Okay, now do one thing. If you cannot write on the back page, write from A to Z. 10 times. Bilaterally. Got it? Okay? So, both sides of the chest, they are moving bilaterally. Okay? If there is some problem, masalan, one side or this side or this side, we will call the chest is not moving bilaterally, it is moving unilaterally. Yani, right side or left side is moving, other side is not moving. Understand? It means there is some problem inside. So here in your report page, because you are normal individuals, okay? So you will write normal bilateral. Okay? Second is
Peripheral cyanosis.
peripheral cyanosis. You know cyanosis?
shortness.
Cyanosis is blue color change of the skin. When you were doing hyperemia, remember hyperemia?
Yes.
You close this, after some time your hand becomes blue. True?
Yes.
This is a type, this is not cyanosis, it is a type. What is cyanosis? Whenever there is hypoxia, you know hypoxia?
Yes.
There is no oxygen, then hemoglobin cannot get oxygen because there is no oxygen. So the hemoglobin becomes balloon oxygenated, deoxygenated. Okay? And the color of deoxygenated hemoglobin is reddish blue, like red and blue. Dark, very dark blue. Just like if you see your skin, you can see blue pipes.
Yes.
These are veins. Veins contains deoxygenated blood. Okay, understand?
Yes.
Okay? So, if there is hypoxia, sure, the concentration of deoxygenated blood increase. When the concentration of deoxygenated blood becomes more than 5 gram percent, more than 5 gram percent, the skin areas, they become blue, and this is called as cyanosis. Okay?
So we write
Here is absent. Yeah. There is no cyanosis there.
absent.
You will write absent. So peripheral cyanosis, absent. Third, inspection of the face. Do you find anything? Halas, normal. Normal.
B, what do you write? What do you write?
No, absent. B is cyanosis. No, not present. Okay? This is normal.
Form of the chest.
D, form of the chest, any shape of the chest. It is normal. It is not pigeon shape. It is not depressed. Now, you understand this or no? Okay. Now we come to palpation. Palpation. For palpation, put your hand upon the chest, lower part of the chest, and the other hand, upper part of the abdomen, lower part of the chest and upper part of the abdomen. Now, just try take some breath, not like this, with your abdomen. So, which of your hand is feeling first? The upper hand or the lower hand? This is the thing. Okay. So this is called as pattern of respiration. Pattern, tarteeb of respiration. In males,